This oversight hearing of the Subcommittee on Health will now come to order. The chair may declare a recess at any point. That was when we were anticipating votes. I'd like to welcome all the members and the witnesses to today's hearing. Many here today have likely heard that the VA has taken significant steps to improve the civilian health and medical program of the Department of Veterans Affairs, CHAMPVA. CHAMPVA is a program to provide earned benefits for veterans' families whenever the veteran has qualifying service-connected disabilities or death. A veteran's spouse or child can access a range of covered health services through CHAMPVA, inpatient and outpatient care, prescription drugs, mental health services, skilled nursing care, and others. CHAMPVA is a way that we honor our commitment to serving the veterans and their families who are injured in the line of duty. Sometimes circumstances require that family members forego a full-time job with health insurance benefits so they can care for their veteran full-time instead. These caregivers consider CHAMPVA a lifeline. Decades ago, Congress created CHAMPVA to close a gap left by TRICARE. CHAMPVA, when it works, is a huge relief for veterans and their families. Affordability is on everyone's mind, and that is especially true for veteran families with serious medical needs. Fortunately, the VA has recently taken steps to ensure CHAMPVA works. I'm pleased that the Trump administration is pulling out all the stops to bring down the cost of living by putting families first. Just before Thanksgiving, Secretary Collins announced the elimination of CHAMPVA application backlog. That's over 60,000 more families who can now access caregiver health care benefits at the VA. The subcommittee appreciates the VA's work to modernize CHAMPVA. Online applications and claims should have been available a long time ago, but if we continue to hold the VA accountable, veterans and their families will see greater results. As a case in point, I'm particularly pleased that the VA is in the process of developing a CHAMPVA provider directory. This is after an abundance of feedback from members of Congress to the VA about the difficulty that beneficiaries have even finding someone who will accept CHAMPVA. The committee has been diligent in exploring solutions for a provider directory. I want to thank my friend and colleague, Oversight Committee Chairwoman Jen Kiggins, for her leadership on this issue, as she recently wrote a letter and introduced legislation to create this system for veterans and their families. Needless to say, we'll continue to exercise oversight to ensure that the CHAMPVA directory is fully implemented. Modernization like this and CHAMPVA's ongoing efforts enhances the convenience of using the CHAMPVA program. And now, VA can process applications and claims faster than they have in the past. I'm encouraged that the VA is now aiming to process 100% of electronic claims within 30 days. It should be noted that in the past, their stretch goal was to process 90% of electronic claims in that time. However, there are still obstacles and opportunities for this program. Navigating VA bureaucracy is never easy. I've heard that certain obstacles remain in CHAMPVA, and I expect our witnesses to highlight these issues today. Foremost, this subcommittee will do its part so that the VA can process 100% of all claims within 30 days, not only the electronic ones. Paper claims still take too long to process. I know delays are inherent and manual processing is tedious, but I look forward to working with the VA to speed up paper processing as well. Second, there is limited transparency for status updates on applications or claims requests. Spouses and children want to know what's going on with their application. Caregivers and providers want to know whether their claims will be accepted or denied. Whenever they hear radio silence from the VA, they lose trust in the VA. This subcommittee spoke with one large healthcare provider who shared that the VA assigned a direct representative to address their claims questions, but the direct representative was too overwhelmed to ever timely resolve the provider's questions. The provider would have to wait months just to get questions answered. And speaking as a veteran and a provider, I want to ensure this provider's experience is a thing of the past. There must be a better way to get information for families and providers so they know exactly what their benefits are ahead of time. Third, the VA could resolve claims faster if it improved its ability to cross-reference a spouse or a child's health insurance and whether that person reached his or her deductible. Because CHAMPVA can function as either a primary or a secondary payer, providers must properly bill either the program or somebody else's health insurance first. Unfortunately, this coordination frequently breaks down, and providers lose time filing the claim only for the VA to require a different form. It's also important to know in real time whether a spouse or child has reached the deductible. Right now, real-time knowledge is unavailable to claims processors. I'd like to see that change. Lastly, some aspects of the CHAMPVA process create snags for caregivers that limit the program's use. The subcommittee has heard most about the fact that CHAMPVA identification cards are in fact not cards, they are strips of paper. Mrs. Benson so clearly explained the issue when she showed this subcommittee her own card. She explained that if anything happens to the card, meaning paper strip, like if somebody accidentally spills a drink on it, it's never happened to anybody in this committee or in the audience, the caregiver must wait for another strip of paper from the VA. Caregivers should not have to ask their neighbor for a laminator to avoid damage or destruction to their healthcare paperwork. I hope this discussion sheds light on these concerns and opens the door to further discussions on how we continue to modernize CHAMPVA and have it work better for veterans and their caregivers. Just like every other American family, veteran families with caregiving responsibilities set aside this time of year to give their thanks to God, celebrate one another, and enjoy tradition. But caregivers must also balance the healthcare demands to ensure that they and their loved ones in need enjoy the season to the fullest. Our goal with this hearing is to make CHAMPVA work as it's intended to serve veterans' families. Finally, I'd like to thank beneficiaries like Mrs. Benson and many others from groups like Senator Elizabeth Dole's Foundation for sharing their stories and bringing CHAMPVA's issues to us. I now yield to Ranking Member Brownlee for any open remarks she may have.
Thank you, Madam Chair, and thank you to our witnesses for being here today, and apologize for the waiting that you had to undergo. But I'm glad to have an opportunity to examine the CHAMPVA program and the significant opportunities for improvement in VA's administration of this program. I'd first like to note that the committee staff have not received a briefing from VA's Office of Integrated Veteran Care since December of 2024, a whole year ago. I hope you agree, Madam Chair, that this is wildly unacceptable, especially considering this office is responsible for administering community care programs that account for more than $40 billion per year in VA expenditures. Committee staff used to receive briefings from this office every other month. I'm very concerned that under the Trump administration, these briefings have completely stopped. CHAMPVA is just one of the programs the Office of Integrated Veteran Care administers, and it's my understanding that they were working on a number of initiatives to improve this program throughout 2024, but we have received no updates in nearly a year. I'm glad VA officials are here today to share their recent progress, but it's clear from our other witnesses' testimony that far more remains to be done, and we need more regular oversight of the CHAMPVA program. Whether it's the lack of online self-service tools for applicants, enrollees, and providers, the lack of a formal provider network or online provider directory, or the lack of transparency for beneficiaries and providers about allowable payment rates, there are many ways that CHAMPVA could work better for beneficiaries and providers. As many of you know, I have long been a proponent of reforms for CHAMPVA. I strongly believe my legislation to allow dependents to remain enrolled until they turn 26, regardless of school enrollment, is necessary to ensure parity between CHAMPVA and most other health insurance plans. However, in previous testimony about my CHAMPVA bill, VA indicated that it does not view CHAMPVA as an insurance plan, but as a medical care benefit. As I said then, if it walks like a duck and swims like a duck and quacks like a duck, it's probably a duck. CHAMPVA has copays, annual deductibles, and maximum out-of-pocket costs. It has a formulary. CHAMPVA requires prior authorization for certain services. It counts as minimum essential coverage under the Affordable Care Act. If that's not health insurance, I don't know what it is. VA needs to decide if it wants to continue to force caregivers and families of veterans to navigate a system that has all of the complexities and frustrations of health insurance and places all the burden of navigating that system on beneficiaries, or if it wants to provide the loved ones of fallen and severely injured service members and their caregivers of our most vulnerable veterans with the best support and health care benefits possible. That's my choice. Ms. Benson, I'm glad we have you here today to speak about your own experiences as well as your work with a Code of Support Foundation helping other families and caregivers navigate the system. It's clear from your testimony that you are well-versed in this program and how to navigate it, but VA should not be reliant on beneficiaries to recruit providers, determine what codes will allow VA to process claims, and know every step of a complex appeals process. The way the system is currently set up, it seems you need endless hours of free time and the equivalent of a PhD in health insurance just to make sure your family can get covered for the care you need. This obviously is not acceptable. I believe it's clear to everyone in this room that there is massive room for improvement in the CHAMPVA program. This hearing is a good step at providing insight and oversight, but I hope it won't end here. And I thank you, and Madam Chair, thank you for the hearing, and I yield back.
Thank you, Ranking Member Brownlee. I'd now like to introduce our witnesses who have been very patient through this process, so thank you again. Testifying before us today, we have Dr. Maria Lorente, Acting Assistant Undersecretary for Health at the Office of Integrated Veteran Care at the VA. She is supported by Mr. David Fennell, Director of Veteran and Family Member Programs, including CHAMPVA. Mrs. Kara Benson, Veteran Support and Strategic Initiative Specialist at the Code of Support Foundation. She is also a CHAMPVA beneficiary. And Mr. Jim Zinner, National Policy Director for the National Association of County Veteran Service Officers. Dr. Lorente, you're now recognized for 5 minutes to present your testimony.
Thank you. Chairwoman Miller-Meeks, Ranking Member Brownlee, and distinguished members of the subcommittee. Thank you for the opportunity to testify today about the Civilian and Medical Program of the Department of Veterans Affairs, or CHAMPVA, a vital program that provides health care coverage to eligible spouses, children, survivors, and caregivers of qualifying veterans. Joining me today is Mr. David Fennell. He's the Director of Veteran and Family Member Programs in the Office of Integrated Veteran Care. CHAMPVA plays a critical role in supporting the families of veterans who've made profound sacrifices in service to our nation. My testimony today will provide an overview of the program's eligibility criteria, current operations, recent improvements, and opportunities for continued collaboration with Congress to ensure timely, efficient, and equitable access to care. Authorized under the United States Code Title 38, Section 1781, CHAMPVA provides healthcare coverage to eligible spouses, surviving spouses, and children of veterans who are permanently and totally disabled due to a service-connected disability, or who died as a result of a service-connected condition, or who died while rated permanently and totally disabled from a service-connected condition. It also covers certain survivors of members who died in the line of duty and certain primary family caregivers under the Program of Comprehensive Assistance for Family Caregivers. To be eligible for CHAMPVA, the individual cannot be eligible for TRICARE. As of November 2025, CHAMPVA provides healthcare coverage to more than 1 million beneficiaries. The program receives approximately 4,000 new applications every week, and more than 90% of medical and pharmacy claims are now processed electronically within days of receipt, ensuring timely reimbursement and continuity of care. Under the leadership of Secretary Collins, and thanks to recent reforms, the application backlog, previously exceeding 70,000 cases, has been eliminated. New applications are now processed in a matter of days. The appeals backlog has also been reduced from over 20,000 to approximately 1,000, with continued progress underway. These improvements reflect Department of Veterans Affairs' commitment to veteran-first service delivery, accountability, and efficiency. Under the last administration, CHAMPVA faced significant delays in application and appeals processing due to increased demand, staffing constraints, and reliance on legacy manual systems. Some applicants waited over 150 days for determinations. Under Secretary Collins' leadership, VA implemented a two-pronged strategy, authorizing overtime for application processors and introducing enhanced process engineering and new automation to streamline workflows. These actions have assured timely access to benefits for eligible CHAMPVA beneficiaries. VA is modernizing CHAMPVA operations to reduce bureaucracy and improve the user experience. In December 2025, we will complete the transition to a more automated application processing system, increasing efficiency and reducing manual workload. These efforts align with VA's broader digital transformation strategies and support the department's goals of transparency, reduced administrative burden, and improved outcomes for veterans and beneficiaries. Access to accurate provider information is another area of focus. Although CHAMPVA beneficiaries may see any provider who accepts CHAMPVA's allowable rates, VA acknowledges that beneficiaries may experience difficulty identifying participating providers or confirming whether a provider is accepting new patients. We're working to improve how provider information is presented and maintained, including updating publicly available guidance and strengthening communication with providers who bill CHAMPVA. We appreciate the continued interest in strengthening CHAMPVA. Over the last few months, VA has made significant strides in eliminating backlogs, modernizing systems, and improving access. We remain focused on delivering timely, high-quality service to those who have sacrificed so much. This concludes my statement, and we look forward to responding to any questions that you may have.
Thank you, Dr. Lorente. Mrs. Benson, you're now recognized for 5 minutes to present your testimony.
Chairwoman Miller-Meeks, Ranking Member Brownlee, and members of the House Veteran Affairs Subcommittee on Health, thank you for inviting me to testify today. It's my honor to return to further the discussion on the inefficiencies and inequalities within the Department of Veterans Affairs CHAMPVA program. At the CODA Support Foundation, we work with veterans and their families every day. Our digital resource hub, Patriot Link, has served over 67,000 military community members to find needed supports and resources. Our case management team has already worked with over 1,300 family members this year to navigate local, regional, national, and government partners to achieve stability through needed financial, social, physical health, and mental health supports. But I'm not just here as an employee. I'm here as a caregiver, an advocate, an Elizabeth Dole Foundation fellow alum, and a CHAMPVA user. I care for my husband, who deployed twice to Iraq as a combat engineer between 2003 and 2006. My husband suffered multiple traumatic brain injuries during his years of service, complicated by toxic encephalopathic process, most likely due to chemical exposure. My 5 children and I enrolled in CHAMPVA in 2017 when my husband was awarded permanent and total status for service-connected injuries. We breathed a sigh of relief, knowing that we would have the safety net of health care for myself and our children, 3 of whom have needed specialty medical care through the years. I testified in June of this year to the subcommittee about the nightmare navigating CHAMPVA has been for our family. Highlights of that nightmare include having to sign a $110,000 promissory note to ensure a needed hospitalization occurred and the chance that CHAMPVA refused payment, and being sent to collections when CHAMPVA claims payments didn't occur in a timely manner, with one provider waiting over 27 months for payment. CHAMPVA's appropriate care has felt anything but appropriate. I'll not rehash my earlier testimony. I know the committee is interested in how the situation looks for CHAMPVA today, if changes have been made, and how those changes have been received since my last testimony. I commend VA for finally clearing the CHAMPVA application backlog. It is beyond time to process applications in real time. I was also overjoyed to hear that claims being submitted electronically are being paid quicker than previously. Yet even with that good news, the situation on the ground for CHAMPVA users remains murky. While the application backlog is cleared, only 2 families I know waiting on their decisions have received notifications of such to date. Provider acceptance of CHAMPVA still remains a challenge. I had a medical complication this year which required me to travel over an hour for outpatient procedures, as they were the nearest willing provider to file. I still pay out of pocket for my children's mental health providers, as we have yet to find a provider who accepts CHAMPVA mental health for kids. I know I'm not alone. At CODA Support, one of our most frequent requests is mental health supports for dependents. We have multiple national and regional providers we work with for those supports. 5 take TRICARE and refuse to take CHAMPVA. To quote one, VA is too difficult to work with. It's hard to place blame on the providers for declining CHAMPVA. Indeed, VA has made it difficult on providers filing claims and on users looking for providers. Lack of a provider network and published fee schedules, unclear claims filing processes, and varied claims payment times contribute to the difficulties. Appeals for denied coverage under CHAMPVA are difficult to navigate as well. A CHAMPVA enrollee recently had her child's claim for an ambulance ride during an anaphylaxis event denied. It took us an hour of digging through claims denial letters, EOBs, and CPT codes to understand what had happened. The denial was due to inaccurate billing codes. While we do not believe the CHAMPVA enrollee will be charged for the ambulance ride, the denial letter listed 3 appellate structures, none of them the clinical appeal option listed on the CHAMPVA website. None of them offered an option for a third-party review, something that was considered routine in today's world of denied insurance claims. As they did in the Senate Veterans Affairs Committee on May 21st, 2025, VA has argued in the past that CHAMPVA is not an insurance product. It's a medical service. I remain steadfast. The industry, the federal government, and more often than not, VA itself treats CHAMPVA as an insurance product. If we choose to shop for insurance through Healthcare Marketplace, CHAMPVA enrollees are not eligible for financial assistance nor advanced premium tax credits. Every year, CHAMPVA enrollees receive a 1095-B attesting to the fact that CHAMPVA accounts for minimal essential coverage under the Affordable Care Act. Finally, even VA states that CHAMPVA is only available to caregivers in the VA's Program for Comprehensive Assistance to Family Caregivers when they have no other health insurance. Thus, CHAMPVA identifies itself as an insurance plan when it offers proof of coverage and bars use of its plans in the face of other coverage. Indeed, the stance that CHAMPVA is not an insurance product is detrimental to veterans' families. At Coda Support, I recently walked a disabled veteran through enrollment for his wife into CHAMPVA. Prior to reaching out to us, the veteran had purchased insurance for his dependent, causing a financial burden through the healthcare marketplace, not understanding that CHAMPVA provided ACA-compliant coverage. In short, CHAMPVA remains a complicated mess for users. While VA has announced positive steps at easing some of these known problems, CHAMPVA fixes are far from complete. CHAMPVA users need statutory change and regulatory clarity, mandated electronic claims filings, and clarity in claims appeals processes, including a third-party review. In VA's mission to fulfill President Lincoln's promise to care for those who have served for our nation's military and for their families, caregivers, and survivors, CHAMPVA is failing. As a community, we cannot continue to allow this egregious lapse of coverage for those who need it most. I thank you for your time, and I look forward to your questions.
Thank you, Mrs. Benson. I now recognize Mr. Zinner for his opening testimony for 5 minutes.
Chairwoman Miller Meeks and Ranking Member Brownlee, distinguished members of the committee, thank you for the opportunity to appear before you today on behalf of the National Association of County Veteran Service Officers. NACVSO or NACVSO represents the government-employed, accredited advocates who help veterans and their families access the benefits that they have earned. First, I want to express our sincere appreciation to the CHAMPVA staff for their extraordinary progress in reducing the application backlog. We are hearing reports of applications being processed on average of 10 days and in some as few as 4. That is not simply an administrative improvement, it is timely access to health care for eligible dependents, and we thank the teams responsible for this achievement. Today, I want to highlight several practical refinements that would increase accessibility and efficiency for CHAMPVA families and the GVSOs who serve them. Our first recommendation is modernizing the CHAMPVA application process. Right now, GVSOs cannot submit CHAMPVA applications electronically. They must print, complete, and then fax or mail them, which prevents confirmation of receipt, prevents tracking, and makes it difficult to provide updates to families. Meanwhile, many dependents cannot use va.gov. A digital submission workflow similar to the Veterans Benefits Administration's National Work Queue would allow electronic submission, real-time status updates, and reduce burden on CHAMPVA staff. Additionally, expanding the VA Form 2122 authority to include VHA and CHAMPVA would allow accredited officers to communicate with CHAMPVA staff directly, speeding resolution of issues for families. Our second recommendation is expanding provider awareness and participation. Across the country, many community providers do not know what CHAMPVA is, who it covers, and how the billing works. Some confuse it with TRICARE or VA Community Care, and this creates avoidable access barriers. Targeted education campaigns, provider toolkits, inclusion in electronic billing systems, and partnerships with medical associations would meaningfully expand access for spouses, dependents, and caregivers. Third, we recommend redesigning CHAMPVA identification cards. Providers frequently mistake the CHAMPVA card for the community care card, and in some cases, dependents have been turned away. A distinct and easily recognizable card would reduce confusion and improve the care experience. Finally, we urge the committee to address the coverage gap for dependent students turning 18. Under current policy, CHAMPVA eligibility elapses until school enrollment is verified, a process that often takes 8 to 9 months. During this time, dependents incur medical costs out of pocket, claims are lost or forgotten, and families face unnecessary stress despite the fact that VBA has already determined the underlying eligibility. Provisional continued coverage, automated verification with schools, online certification at va.gov, and pre-verification notices would significantly reduce this burden. CHAMPVA is a very strong program, and recent progress demonstrates VA commitment to families of those who have served. But continued refinement is both necessary and achievable. Government Veteran Service Officers stand ready to assist VA and this committee in improving processes, expanding access, and ensuring that eligible family members receive timely, reliable health coverage. Thank you for your leadership, and thank you for the opportunity to testify today. I'm happy to answer any questions. Thank you.
Thank you very much, Mr. Zinner. As is my typical practice, I'll reserve my time until all of the members have had a chance to ask their questions. I now recognize Ranking Member Brownlee for 5 minutes for any questions she may have.
Thank you, Madam Chair. My first question is to Ms. Lorenta. Thank you for being here. We know based on Ms. Benson's testimony that even despite VA's recent elimination of the application backlog, and that's a good first step. I want to acknowledge that. That's a good first step. But many families are still waiting to know the status of their applications and their school enrollment certifications. And the only way for them, the way I understand it, is to check their status is to call the call center, the CHAMPVA call center. So do you know what the average wait time is to talk to someone on the other end of the call center?
Yes, ma'am, thank you. It can vary based on the time of day, the day of week. In some cases, it could be as little as 5 to 10 minutes. In other cases, it could be as long as several hours.
As long as how many?
Several hours.
Several hours.
Yes. We do have a callback feature that is part of the call center, but it's not acceptable.
Well, I know the committee staff called the service line 4 times, and all 4 times there was a message saying that the wait time would be over 2 hours. Not 2 hours, but over 2 hours. So why, I mean, that seems like an easy problem to solve, and I don't know why it's not being solved. I mean, it is great to attack the backlog. That's great. But if people can't get finality to the situation, that's not great. And this is, waiting more than 2 hours for folks can be pretty frustrating.
Yes, ma'am, I agree with you. We are taking a series of steps in order to address the issue, and I wish that it was an easy problem to solve, because please be assured, if it was, it would have been solved. Some of the various steps that we are in the process of taking are looking at our workflows, standardizing some of the workflows. We've also begun leveraging additional contractor support. We do have a contractor with whom we work that assists in surging and answering the call center. A very important step that we are working on conducting is being able to do online status verification, so that there would not even be a need for a phone call. The veteran and/or the beneficiary would be able to check online and be able to see the status of their application, the status of their claim. But and we are planning to be able to do that in 2026. Efforts are underway. These are some of the steps that we're taking.
Okay. Until that program happens, if somebody is waiting over 2 hours to talk to a live human being, their issue has not been resolved, then do they just have to say thank you very much and try next week and go through the same exercise? Or do you prioritize that person and call them back with a resolution to what the issue is, so that they don't have to continually go through this horrendous process?
Yes, that is one of the features that are part of our call centers. We are able to call the veteran and/or the beneficiary back.
Okay. Ms. Benson, so again, thank you for being here. You've been quite helpful to us looking into this process, so really appreciate your time and focus on this. In your testimony, you discussed how difficult it's been to find pediatricians and mental health care providers willing to accept the CHAMP VA payment. So, and I know you talked about, having a list of a network of providers, that you can reference somehow. I don't think that that's going to happen overnight. We're still arguing with the VA whether this is an insurance policy or not. But what are your suggestions? What do you think VA could do to encourage more providers into this program?
Thank you for the question, and thank you for having me here again. I think one of the first things that we need is provider education. Providers don't know they have to enroll in the EFT system. Providers don't know that it runs on a Medicare or Medicaid backbone versus a TRICARE backbone. I've had to actually walk urgent cares through how to file and what system to file it on. That knowledge is going to be key in getting to providers to come on board. What will also be key is providers knowing how much they're going to get paid. It's fine that there's an acceptable rate. Most providers I talk to know that it is somewhere within the CMS rates, but that it vacillates. For me, and I am a layperson, but looking back at it going, it's out of IVC, there is a CCN, there are already contracts available, it's mind-boggling to me that we can't use a backbone that's already there.
Thank you. My time is up. I yield back.
Thank you, Ranking Member Brownlee. I now recognize Representative King-Hines for 5 minutes for any questions she may have.
Thank you, Chairwoman and Ranking Member Brownlee. Before I begin, I want to say thank you to Secretary Collins and the VA team for making good on the promise to cut down the significant backlog of veteran claims. That progress matters, not just in numbers, but in real lives, in real families, and in the trust veterans place in the organization. It shows what's possible when the VA focuses on outcomes instead of obstacles. I'm also very encouraged that you're finally moving to modernize CHAMPVA through the provider directory. For families, especially in the territories, I'm from the CNMI, that's the district that I represent, simply knowing which providers are available, which ones accept CHAMPVA, and where they can turn to for care is very critical. So it's long overdue, and it's a positive step, and I want to give a big ups and kudos to all of you. But even with these improvements, the challenges remains very serious for my district. The GAO has been very clear. Veterans and their families in the CNMI and across the territories face some of the highest barriers to healthcare access anywhere in the United States. And those same structural gaps, too few providers, limited specialty care, long-distance travel, and virtually no territory-specific data directly affects the families who rely on CHAMPVA. So for us, right, on paper, CHAMPVA is available everywhere where the flag flies, but in places like the CNMI or Guam, access can still feel more theoretical than real. And I don't think that we can fix this issue if we can't, if we don't know what to measure. And Congress can't hold the VA accountable without the data. So today, I hope that we can have a conversation about the gaps in data, right? So that these benefits on statute actually truly works for everyone, no matter which zip code you live at. And so my question then is how can the VA assure Congress that this program is functioning equitably if it does not track utilization, access, wait times, or outcomes for territories? Because I scoured the internet, I scoured the GAO reports, IG reports, and I don't see any data with regards to this type of program for the territories.
Yes, thank you very much for that question. And you're right. To the best of my knowledge, we're not tracking wait times. We are not tracking specific outcomes for the beneficiaries that are in the program. We are able to look, based on claims, how many claims are coming from what area. I don't know the specific data, and we're happy to take it for the record to find out, by territory, the number of at least claims that have been paid. That gives us a sense of the the services that are being offered in that area. I think that that's one of the reasons why we have come to appreciate that a provider directory is a very first step, but is a first step, so that we can begin to even assess the adequacy of the existing providers that we have. It will also help us to provide more targeted outreach, so that if, for example, to Mrs. Benson's point, we see that there's an area that lacks a pediatrician that is a CHAMPVA provider, we will specifically reach out to all of the pediatricians in that geographic area and try to work with them, maybe work with a professional organization, for example, to encourage their participation in CHAMPVA. It's just an example of what we've been discussing internally as mechanisms to be able to address some of these problems.
Thank you, I appreciate that. And, you know, I do have some data here with regards to fiscal year 2023. What we're seeing in the CNMI is that we have 45 enrollees. We only have 15 users at a utilization rate of 33.3%, which is a drastic, there's a significant difference with regards to how the trends are across the United States in comparison to this utilization number. And I just kind of wanted to get a better understanding of why you think that is and how we can make some reforms to be able to get more people to be, one, aware of the program, two, know which care providers that they can go to so that they can have access to some of this care and, you know, have the data to be able to justify whatever infrastructure that is needed to be put into place in the territories.
Yes, ma'am. What I'd like to be able to do is first obtain the more recent data from FY 2025. The data that you cited is in keeping with what we have seen. That is, overall, we have about 67% utilization of CHAMPVA services within our total group of enrollees. So I would like to see if there's been any difference between the 23 numbers that you cited and the 25 currently. And then you're right, we need to dig into it and try to have a better understanding of why there are differences if in fact we find differences.
Okay, thank you. I'm out of time. Thank you.
Thank you very much. The chair now recognizes Representative Sherfilis McCormick for 5 minutes for any questions she may have.
Thank you, Madam Chair, and thank you also, Ranking Member, for holding this important hearing. You know, serving our veterans and especially their families is one of our primary responsibilities and promises. So I'm happy that we're looking at CHAMPVA, especially since it serves over 700,000 people. In Florida, we're looking around my district, 60,000. And we've had several questions to the families who are using CHAMPVA. While CHAMPVA is imperfect, it provides a lifeline to so many families, and it must continue to be bolstered and strengthened to adequately serve those who need it the most. Over the past few years, I've heard from veterans and their families about their exposure to environmental toxins while living near the military installations. Whether it's Red Hill or Camp Lejeune, we've seen the devastating effects of toxic exposure on families like cancer, infertility, and neurodivergent diseases. This is of concern for military families, and no military family should be left behind to fend for themselves. Dr. Laurent, has your department looked at expanding the scope of CHAMPVA to include military families who have been exposed to toxins?
At this point in time, the eligibility criteria are in statute, and we include or deem that a family member is eligible based on those existing criteria. Within the Veterans and Family Member Program, we do have certain outcomes-related additional programs, such as the Spina Bifida program. We have the smaller Vietnam veteran women's whose children have certain disabilities. And then we also have the Camp Lejeune Family Member Program. Each of those is designed for very specific situations, very specific toxic exposures. And so those are the programs that we currently have.
And do you think there could be other avenues to provide coverage, or do you think that CHAMPVA can solely handle it?
Well, because I've described some very, very specific areas, they only covered those areas. We're more than happy to work with Congress in order to explore any other areas that, could be assessed and reviewed in the future.
I guess my question also is, because we're thinking about how many people are actually being exposed, are there other departments or other areas that we should look into in addition to CHAMPVA? I don't know if you would know that answer.
I was just about to say, I don't think that I'm necessarily prepared to address that question today, but more than happy to take it for the record and reach out to some of our other program offices that I think are better suited to be able to address that question.
Thank you. While I'm optimistic about the future of CHAMPVA, I understand that the current program is not without its issues. Ms. Benson, I was deeply disturbed to hear that you had to put over $110,000 promissory note in CHAMPVA, refused to cover a medically necessary hospitalization. This is definitely unacceptable. No person, especially the spouse of a veteran who has served our country, should ever have to put a down payment just to see a doctor. Dr. Lorraine, how typical is this required for people to put down a down payment?
Congresswoman, I have to be frank with you. I've not ever encountered this type of a situation before, and I would like to separately reach out to Mrs. Benson to have a little more detail about the specific circumstances, not only to be able to address this specific issue, but to have a sense of, are there gaps that we're not addressing so that we can figure out what are the steps that need to be taken so it doesn't happen to other people.
So is this the first time you're hearing of this kind of situation?
It's the first time I'm hearing of it, yes, ma'am.
Okay, and how would you feel if we had any kind of agreement or arrangement to actually track these situations and other outliers, just so we can make sure that this isn't happening and that there are other obstacles to actually...
I would very much appreciate any similar types of situations or any other kinds of cases like this, specifically because it's our duty. As we've discussed, it is our duty not only to take care of the veterans and their families and caregivers, but to fix problems that need to be fixed.
Thank you so much. I yield back.
Thank you. The chair now recognizes Dr. Dexter for 5 minutes for any questions you may have.
Thank you very much to Chairwoman Miller-Meeks and to Ranking Member Brownlee for again having this very important hearing, and thank you to our witnesses for coming to testify today. According to data from the Veterans Health Administrator's Office of Integrated Veteran Care, there are over 10,000 Oregonians enrolled in CHAMPVA, and to those Oregonians, we have made a solemn promise, as we have been discussing, that in return for the immense sacrifices their family members have made, we will ensure they get access to health care services they need. However, as Ms. Benson has shared in her testimony, we continue to fall short on delivering on that promise. When a family member who is owed care through the VA is sick, the last thing in the world that they should be doing is fighting through red tape to be seen. And they most certainly should not be signing promissory notes agreeing to pay hundreds of thousands of dollars for care in case the VA payment falls through. So as the number of CHAMPVA beneficiaries continue to grow with PACT Act implementation, and if more families are forced to turn to this coverage because Congress is unable to implement a fix to the ACA premium tax credit enhancement being taken away, we must be focused on getting this system to work better for families. Dr. DeLaurenti, in your testimony, I was pleased to see discussion of the need to address the dearth of information about where CHAMPVA beneficiaries can seek care. As I understand it, under the current system, beneficiaries have to individually contact providers, and we have discussed that. It's obviously frustrating and it needs updating. It strikes me that one solution to the dearth of option available to CHAMPVA beneficiaries would be to require community care network providers to accept CHAMPVA payments. This would also have the benefit of meaning VA would only have to maintain a single provider directory. Can you comment on any statutory or regulatory hurdles that would need to be overcome to consider this as an option?
I appreciate that question. I don't know the answer to that question. Let me check for a moment with Mr. Fennell to see if he has some recognition or knowledge to be able to address.
I think it's an unfair thing to ask on the fly for you to put testimony before a congressional hearing. So I'll just ask that we do, and we ask for many questions to be responded to, and often we don't get them. If I can just assure myself that you will get back to me, that's
Absolutely.
totally appropriate. Thank
Yes.
you. As this committee continues to discuss and conduct necessary oversight of this program, Dr. DeLaurenti, can you share the date on which the number of backlogged applications peaked and the number of pending applications on that date? Like the high point when we had the worst backlog?
Yes, ma'am. It was approximately in May of this year, 2025.
Okay, thank you. And can you share the percentage of applications that were approved versus denied in 2025 compared to the same period in the prior fiscal year?
I don't know the percent approved in FY24. I do know that in FY25, approximately 80% of the applications are approved.
Okay, thank you. And I have heard that VA, to clear this backlog, may have set up a separate queue for beneficiaries that have another form of insurance with an unreported backlog. How many applications are in this queue awaiting a determination from VA?
I'm going to ask Mr. Fennell to address that question, if you don't mind.
No, please, Mr. Fennell.
Yes, thank you for the question. And currently, we are now processing and have the ability to process OHI with the application. So that's a process improvement that we've included in order to expedite both of the processing of OHI, other health insurance, and the CHAMPVA application. Right now, we are applying automation to those OHI documents that are separate, and we are able to automate the processing of a grand majority of those. And so we had a height of around 300,000 when we initiated the queue that you referenced. And I think now we are in real time, meaning we were processing those as quickly as we are the applications themselves. And I want to say we might have around 20,000 remaining to process. But again, in applying those process and automated solutions, that is real time, meaning over the next week, those will be processed.
And if I may, to follow up on that, so 300,000 almost immediately, I'm assuming these automated tools are AI generated. Are quality control making sure that the right determinations are happening for our CHAMPVA?
There are, and so the quality control measures are the business rules that are up front that we apply, and some of that may not necessarily be AI as much as just a business rule that follows statutory and regulatory guidelines.
Okay, thank you. I'm over time. Yield.
Thank you very much. The chair now recognizes Dr. Conaway for 5 minutes for any questions you may have.
Thank you, Chairwoman Miller-Meeks and Ranking Member Brownlee, for putting this hearing together so that we can conduct a much-needed oversight on this very important program. As of November 2025, CHAMPVA is providing health care coverage to more than 1 million beneficiaries. At a time when health care prices are increasing and the expiration of the Affordable Care Act is looming, we must strengthen this health care program for independents and survivors of veterans. In my state of New Jersey, premiums are projected to increase by 174%. The average annual premium cost could jump almost $2,800 on average, and for some, it could mean that costs will go up by tens of thousands. This is unacceptable, and I encourage my colleagues to find a solution to this looming cliff that so many Americans will face with respect to their health care if a solution is not found to the problem of the expiration of the premium tax credits. I'm curious to know, Ms. Laurent, do you anticipate the expiration of the ACA tax credits will impact enrollment for CHAMPVA?
Thank you very much. I appreciate that question. And I truly don't know the answer. We still would need the veteran sponsor to meet the eligibility criteria. And so that becomes, sort of the first thing that has to occur. But I simply don't know how many spouses or dependents of veterans that are 100% service-connected, permanent and total, are currently receiving ACA benefits.
Are you conducting any planning and anticipation of the some 20 million people who are going to lose these tax credits, are you doing any anticipatory planning to prepare for a potential influx of new applications as the people can no longer afford their health insurance benefit or health insurance under the ACA?
Our primary planning, and we do work very closely with projections and enrollment, and as well as with VHA Fiscal, has been looking at the increasing numbers year over year of beneficiaries who've been enrolling in CHAMPVA. For many years, that figure was pretty steady, about 5 to 8% year over year growth. Then PACT Act was enacted. That growth went to about 13 to 14%, and during the past year, we've seen almost a 22 to 23% increase. That in and of itself, we are and have been tracking very, very closely. We are engaging in projections so that we assure that we have sufficient budget currently and in future years to address the healthcare needs based on past expenditures with adjustments for those increases. Have we factored in impact from ACA specifically? No, sir, at this point we have not.
And just, do you know then how many of your enrollees also have insurance under the ACA? Do you have that number?
I do not. Let me check with Mr. Fennell. Do you know?
Thank you, sir, for the question. I do not know the answer to that question, but I am apprised of the eligibility criteria, and I don't see a situation where that changes with the ACA tax credit, which is permanently and totally disabled.
That just reclaim my time because I'm running out.
Oh, sorry.
So you don't have. I just want to get to this question of the lack of providers in particular markets, and what's being done about that. Now, typically, I mean, as one who ran a practice years ago, you sort of have to determine. When you determine to bring on an insurance policy, how much does it pay? Is it worth my time compared to the other insurances that I accept, covering people who can come to the office? So is one problem that that CHAMPVA is not paying enough, and two, that it's perhaps too difficult for people to enroll in CHAMPVA? Have you looked into that, and how are you addressing those factors, which I'm sure are impacting the number of physicians who are accepting CHAMPVA patients?
Yes, sir. Thank you, and happy to answer that question. We are required by law to pay like or similar to TRICARE. So that's actually, those are the payment methodologies that are loaded into our system, our TRICARE methodologies. The other aspect to this is we are normally a secondary payer benefit. So if they have Medicare or they have other health insurance, that's going to be billed first, and I would imagine that would be of primary concern to the treating physician. But if it does get to a secondary payment, we would pay like or similar to TRICARE.
Thank you very much, Dr. Conaway. I now recognize myself for 5 minutes. If I can, I'm just going to have a point of clarification. Certainly myself and members of my party and members of this committee want to make sure that healthcare costs are brought down for everyone, not just a select few that may be on enhanced premium tax credits. And the premium tax credits under the ACA are not expiring. Only the enhanced premium tax credits are expiring. So I thought I would put forth that clarification since this is entered into the record. Additionally, we don't force providers to accept Medicaid. We don't force providers to accept TRICARE. And being a provider and a veteran, it seems to me that forcing providers to accept CHAMPVA who are in the community, would that be considered indentured servitude? So I will pose that question to Dr. Lorente, and you can submit an answer in writing. So thank you for that, just making those points valid, that we look at the constitutional nature of what it is that we may require of someone to do. Dr. Lorente, what's the industry standard for the amount of time to process claims, both paper and electronic? And then how does the VA compare if you have that information?
Thank you, Chairwoman. I don't know the answer to that question, but happy to take it for the record and then provide the comparative numbers.
And then I applaud the efforts at getting through the backlog and applying more technology to improving backlog, and also your efforts in trying to keep family members and providers up to date on the status of their claims. And to that end, is the VA using artificial intelligence or augmented intelligence to improve both applications, the claims process or status, and updates for that? And if so, how? And if not, why?
Thank you very much for that question. I'm going to ask Mr. Fennell to address that because he's way more technical savvy than I do.
Thank you for the opportunity to answer that question. And it began, as I answered before, with business rules and loading those into the system to make automated decisions. When it comes to artificial intelligence, which brings in an additional capability, we are starting to apply some of those capabilities when it comes to these newer modernized platforms that we are moving into for processing both claims and eligibility applications.
And Ms. Benson, I think that you've answered this question in your testimony, but I just want to reiterate it. Would it help to have a provider directory for families and caregivers? And if so, are you supportive of Representative Kiggins' legislation?
Thank you for the question. I'm not familiar with the legislation, but I can say it would be helpful to have both a contracted network and a provider directory. Yes, thank you.
Great, thank you. I yield back. I want to thank all our witnesses for being here. I'm going to recognize Ms. Brownlee for any closing remarks you may have. My apologies. We have another member snuck in. The chair now recognizes Representative Kiggins for 5 minutes for any testimony she may have.
Thank you, Madam Chair, for having me here today to discuss the Civilian Health and Medical Program of the Department of Veteran Affairs, or CHAMPVA, and to highlight how Congress can improve this program for our veteran caregivers and dependents. I represent Hampton Roads, Virginia, which is home to thousands of veteran families who use the CHAMPVA system to support our nation's veterans and to access their veteran health care. Caregiving requires tremendous sacrifice, but access to quality health care shouldn't be one of them. CHAMPVA is a vital program for the caregivers and dependents of permanently disabled veterans. It ensures they can continue to support the veteran in their lives and still receive the health care services they require. However, it can be difficult for caregivers and dependents to find providers in their community that accept CHAMPVA. On most occasions, caregivers have to do their own research and find specific providers that will take their coverage. To rectify this situation, I introduced the Clarity on Care Options Act, which directs the VA's Community Care Network to create a public-facing list of all providers who are in network for CHAMPVA enrollees. We must make this provider information accessible to caregivers and dependents of disabled veterans. The easier we make finding health care for our caregivers, the more time they can spend with their loved ones. I want to thank our witnesses for taking the time to educate us about the gaps we see in this program and what we can do to help increase support to those who support our men and women who served our country. With that, I have another few questions for our witnesses if there's time. When it comes to finding providers that accept CHAMPVA, how is your experience, and this is for Ms. Benson, how has your experience been? Is there any difficulty locating specialty healthcare providers who accept CHAMPVA?
Thank you for the question. Yes, there's a terrible issue. Back to the hospitalization I mentioned, I had a daughter who needed specialty care. I called 26 hospitals across the nation, only one would take. Even today, I pay out of pocket. No mental health care provider, and I am in Florida, between two large metropolises, accepts CHAMPVA for teens. Even for myself, if it is not hospitalization, which is mandated to file, only one major network takes it. So we end up paying most of our care out of pocket, above and beyond CHAMPVA and cash.
Thank you. And Mr. Zenner, from your perspective, what barriers do you often see beneficiaries of CHAMPVA face when it comes to accessing their benefits?
Yes, thank you for the question. Very similar. Lack of education of providers, confusion with the CHAMPVA card itself are two of the biggest barriers that we currently see as county veteran service officers.
So would a directory or a list of providers of sorts be beneficial then?
Yes,
in
it
these cases, for sure. And then for Dr. Lorente, many caregivers report learning about CHAMPVA only years after becoming eligible. In most cases, as the program is currently, how do veteran dependents find out about CHAMPVA?
Yes, thank you very much for that question. So there are a couple of different ways. One is that part of the changes that have occurred in VBA, when the veteran becomes permanent and total 100%, part of the packet that they receive describing the rating includes information about CHAMPVA for their dependents and how to enroll in the program. The second way is the CHAMPVA program itself does do direct outreach to potentially eligible beneficiaries, advising them of the program and how to apply for it. We are continuing to also engage in additional outreach efforts because one of the things that we've discussed internally is that we could certainly be doing a better job of promoting this benefit.
And specifically, how is the VA improving the CHAMPVA's phone and customer service operations, given reports of long wait times and inconsistent information?
So we've engaged in a series of steps towards that. One is we have increased contractor support that can be specifically surged during peak times. In addition to that, we are working on implementing some new telephony systems so that it will begin to offer more in the way of self-service so that those issues that can be addressed via self-service are addressed, and then it moves those clients, those persons that need agent-assisted calls, it sort of, separates out the ones that can be handled via self-service. In addition to that, we're looking at our workflows, streamlining some of those, being able to standardize some of the workflows as well, because there are things that we've identified that are being done, with too much variance, and that's also then leading to some of the delays. Just a few examples.
Yeah, great. Thank you for working on that. And last question, has the VA I'll save it for later. Thank you. I yield back.
Just to know that I'm fair to everyone in the hearing room. Thank you. Your time has expired. The gentlewoman yields back. I would now recognize Ranking Member Brownlee for any closing statements you may have.
Well, I would just say, Madam Chair, I thank you for having this hearing. I think we need to get the VA back to briefing staff so we can keep updating on, what progress is being made. That's the frustration. We don't have a plan in front of us. We don't have a timeline in front of us. So there's no way for us to do the oversight that we really need to do. This is an important program that we need to get right. And I think we're all clear on where the problems lie and what needs to be done. And it's a matter of doing it. And if the Secretary was willing to hire more people or give people more overtime to deal with the backlog, we need to do the same to all these other problematic areas to get them, up to speed and running. So I honestly believe that if we accept the fact that CHAMPVA is more like an insurance plan than a medical care benefit, you will see directly what needs to be done and how to do it if you just follow the model of what insurance plans do, and including a directory of providers, whatever. But we need to have the oversight, and I hope we can have another hearing to do our due diligence as we move forward. But I thank you all for being here. And Ms. Benson, thank you for being here. Thank you for all the help that you do for so many other veterans who need your help, veterans, their families, and caregivers who need your help and support. I yield.
Well, certainly it is an important hearing. I appreciate, Dr. Rente, what you and the office has done to improve the backlog. And then your continued work on keeping family members and caregivers trying to improve the knowledge of where their claims are, and then the other efforts that we need to take on provider education, as Ms. Benson and Mr. Zenner had said, how to file claims and how much they're paid so that we can get providers into this very important program to make sure that both family members, spouses, and caregivers are aware and have access to the benefits that those veterans have earned for them. I'd like to take this time to thank everyone for their participation. Thank you so much for your patience, and I do apologize. Although it was out of my hands, I still feel it's necessary to apologize for the inconvenience to you all and to those who wanted to participate in today's hearing. And I appreciate the discussions we've had on this important topic, and we will continue to have oversight. The complete written statement of today's witnesses will be entered into the hearing record. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous material. Hearing no objections, so ordered. I thank the members and the witnesses for their attendance and participation today. This hearing is now adjourned. Yep, I wrote down your suggestion. So.